Teresa Hurtado Diaz. I'm originally from Mexico. I came to this country when I was 16 years old. I attended Windsor High School, then I transferred to the community college and Santa Rosa Junior College. I got an associate's in biology, and then I transferred to Sonoma State University, where I got my bachelor's in molecular and cell physiology. After that, I moved to the Bay Area, where I found a job in a biotech company. I worked for 4 years with them, and I fell in love with it. I then decided to go back to school and apply for the clinical lab scientist program. So this is a 1-year program that is offered by different universities in the Bay Area. UCSF, San Jose State University, San Francisco State University, and UC Davis. This is a 1-year program, full-time, so you have to do an internship at a hospital, and you have to study different courses, like medical microbiology, chemistry, hematology, transfusion, virology, molecular biology. So all of this within a year. It's an accelerated program, and after this you have to take a California board exam. So once you pass your board exam, then you get your license, and you're able to work at a hospital, at a clinical lab in a hospital, or at a clinical lab like privately, like I do. I work in a private lab. My company is called Garden Health, and we mainly do liquid biopsies, genetic sequencing. So we process samples from cancer patients, and we do genetic sequencing to decide, this genetic sequencing is done to decide what treatments are best for this type of patient and for the type of cancer that this patient has. So depending on the mutations, the doctor decides what treatment works best for them. So that's what we do on a daily basis, run samples for cancer patients. It took me a while to get my license because I didn't know what I wanted to do. But if you are sure that you want to go into the clinical lab scientist field, you can apply after you get your bachelor degree and to the program. And within a year, you can have your license. The pay is really good. Right now, we have a shortage of CLSs since most of the CLSs are retiring right now. And also with COVID-19, many labs have opened, and so you need to have a license to be able to process human samples. Right now the demand is really, really high. They're paying really good. They give bonuses. And it only, it's 1 year after a bachelor's, and you can get your license. I really enjoy it. I love the work I do. I did my training at San Jose State University, and I rotated at Stanford Hospital. Usually where you train or you rotate, where you do your internship, that's where you find a job. I got offered a job at Stanford, but I like biotech, so that's why I wanted to come to work at Garden Health. So I found my job. I graduated last year on March 2020, and I found my job I started at this job on April 2020, so it didn't take that long. Like I said, the demand is really, really high, and there's a lot of companies that are hiring clinical lab scientists. So you have to have a bachelor's in science, obviously, because there are some like main courses that you're required to take, like to join the program, like medical microbiology, virology, biochemistry, hematology. Those are a few of the classes that you need to take before joining the program. So make sure you do your research before you apply to the program. That way you meet all the prerequisites. So if this is what you want to work with patient samples, you want to work at a hospital in a lab, this is the right job for you. So I highly recommend it. Yeah, it's a full-time program, so be ready for it. But it is doable. I was able to do it. I could not afford to be you know, of work, so I worked part-time and I was a full-time student. So yeah, it is possible. So now I have a license, so I'm a clinical lab scientist. Yeah, so if you have any questions or you know, any comments, you can always contact me. Rafael has my information. But yeah, do your research and good luck in your career. Yeah, thank you.